Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, Metro Manila hospitals reporting a surge of COVID-19 cases, but the health department says there's no need for a timeout just yet. Also, Malacañang insists the country can no longer afford to return to ECQ or a nationwide lockdown. And President Rodrigo Duterte warns the public about relaxing COVID-19 health protocols. Philippine General Hospital Director Legaspi and St. Luke's Medical Center Chief Medical Officer and Vice President Benjamin Campomanes join us live. PVOX has raised the alert level in Taal volcano to alert level 2. State volcanologists say this is due to increasing activities in Taal. In its 8 a.m. bulletin, PVOX says that probable magmatic activity may lead or may not lead to an eruption. At alert level 2, evacuation is not yet recommended, but the public is prohibited from entering the volcano island. Residents near Taal are advised to be prepared and listen only to verified sources of information. Stay tuned to CNN Philippines. This is a developing story. Let's go straight to the source of the story. First off, we have PVOX Volcano Monitoring Chief Mariton Bornas. We'll start with Mariton first before we go to Dr. Legaspi. Mariton, good morning to you. Thank you for your time.
Hello, good morning to everyone.
Okay, so it's alert level 2 now, which is really what it means is increasing unrest. What more can you tell us about Taal volcano right now?
Well, it has almost been a month since Taal entered a period of restlessness. So we've been recording volcanic tremor for the past month, since February 13. In fact, we issued an advisory on February 15, alerting the public of increased seismic activity. So currently, we've already totaled more than 866, total of 866 volcanic tremor. This is on top of 141 local volcanic earthquakes recorded, and we have also recorded a hybrid earthquake in Taal, and we have not recorded this since January. Now, what all of this earthquake activity indicates is that there are volcanic fluids that are moving beneath the edifice. Now, the fluids are within 2 kilometers, very shallow. There is no new magma intrusion that we have detected so far, unlike when the volcano was erupting in January 2020, when we had earthquakes that were clearly defining the path of magma going up from Balayan Bay to the Taal edifice. So we don't have that kind of activity. But we do have already in place magma beneath Taal Volcano Island that is at unrest. So there is magmatic activity. So it's either the magma is moving about or migrating, or it's degassing and causing all of this unrest, or you have hydrothermal unrest as well. So there are hydrothermal fluids that are causing all of this activity.
Mariton,
so it's a combination of these things.
I hope you don't mind, no? Can we speak in simpler terms, siguro?
Okay.
Opo, kasi mahirap intindihin para sa akin din po. Ano ho ang napansin ninyo ngayon sa Taal, kaya tumaas to alert level 2?
So, yung record ng volcanic tremor, so we hindi po siya nawawala. In fact, in the past 24 hours, lumakas yung energy niya. Now, yung volcanic tremor is a kind of earthquake that's very special, especially given off by volcanic fluids.
Opo.
No, it's not like the other volcanic earthquakes na related sila sa pagbitak ng bato. So, this is mainly yung motion ng fluids. So yes.
Go ahead, Mariton.
So, but this activity is happening in the shallow portion lang ng bulkan. So, we're talking about material that was already in place or umakyat na noon pang nag-erupt yung bulkan. It's not like Apo, naiwan.
Opo.
Naiwan.
Opo, yung naiwan doon, parang yun ang nagkakos. There is some activity there, kaya nagkakaroon ng volcanic tremors, tama?
Yes, yes.
Opo.
Volcanic tremors, low frequency volcanic earthquakes. Yes.
And how many have you recorded, let's say, in the past 24 hours?
In the past 24 hours, we've recorded 28.
28.
And volcanic tremors and 4 low frequency volcanic earthquakes. There have been days that the tremor lasted for hours, no? Almost a day.
Pero, Mariton, yung mga pinakamalapit na area around the volcano, of course, no man's land naman yan, di ba? Pero, yung, ano ba yung pinakamalapit na area sa Taal? At ano, meron ba silang nararamdaman doon where the residents are?
Well, these earthquakes are very imperceptible. No? They're quite weak. Hindi sila katulad nung ang mga lindol na naganap that occurred during the eruption. They were really strong because magma was really trying to push up the volcano. No? So this time, these earthquakes are really imperceptible. So we do not have any felt earthquakes. But the neighboring towns, particularly Laurel and Agoncillo, they are quite close. No? They are on the western side of Taal Lake. And these are the closest municipalities to Taal Volcano Island. But right now, we are not recommending evacuation because we are not seeing any large magma involved. So if this unrest will ever proceed to an eruption, what we are thinking of is that it will be a minor one.
I see. Okay. But patuloy naman yung pag-monitor ng PHIVOLCS regarding this.
24/7 po tayo, hindi po natutulog ang monitoring divisions ng PHIVOLCS. No? Nagmamanman po tayo 24/7.
But you know, Mariton, the thing here kasi is what happened last year in 2020, hindi ba bigla na lang kasi ang bilis nung pagtaas from alert level 1, umabot sa, was it 4? In a matter of hours. Ano? So dapat siguro very cautious pa rin yung mga, especially the residents nearest to Taal, which as you mentioned a while ago, would be Laurel and Agoncillo.
Opo, that is true. If we are seeing yung parameters before that the 2020 eruption, then we will be more extra cautious.
Okay.
Lalong-lalo na yung ground deformation. But this is not the case now. No? Yung ground deformation, napaka-slight niya. So, walang malaking volume ng magma na nagpapaalsa sa Taal. No? So, hindi katulad siya nung 2020.
Okay. So, all right. So, we'll continue to monitor the situation. When is the next bulletin of PHIVOLCS regarding this?
Kung meron, ang regular bulletin po natin ay every 8 o'clock in the morning, alas 8 ng umaga. But if we have further developments, then we will release an update or an advisory.
All right. Mariton Bornas, PHIVOLCS Volcano Monitoring Chief, thank you so much for your time. We'll be taking a short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Thousands more Filipinos are getting infected with COVID-19 by the day, but authorities are not keen on calling this a surge, nor are they keen on tightening restrictions. The caseload is nearing 600,000 after recording over 3,000 infections Monday. Experts from Okta Research say daily cases could reach 4,000 next week. In his speech last night, President Duterte made an appeal to the public amid the rising number of COVID cases. Here's the president in his own words.
Kasi ng mga holidays, dikit-dikit ng tao. Ito na yun ngayon. Ito na ngayon ang resulta. Taas na. Kasi you abandon the protocol. That's number 1. Kasi kung magmaskara ka lang, tapos may face shield ka, imposible na mahawa ka. Huwag mo lang gamitin yung kamay ron sa mukha mo. Maniwala kayo sa gobyerno, sumunod lang kayo. Without knowing it, maybe asymptomatic ka, you pass on your. Kung ang hygiene mo sa labas, mabuti, may maskara ka, social distancing, and the washing of the hands, alcohol. Sabi ko nga sa inyo, punta kayo sa gasolina, hindi ko nagpapatawa. Yung pagtubil.
So how do hospitals deal with a surge of COVID-19 cases? Let's go straight to the source of the story. We have Philippine General Hospital Director Legaspi. Director Legaspi, thank you so much for your time. I want to find out first and foremost, tell us the situation now in PGH.
Good morning, Pinky. We have stabilized since the observed rise last week. No? So just to give you a background, we've been used to, okay, our peak was 220 last year in July and August, and then we've been at 60 the last few weeks and months. No? So the slowly rising number went up to as high as 108, 110. So of course, if we didn't act accordingly, it's as if we didn't learn anything from the past. So we just started instituting our measures to adapt to this slow rise.
Dr. Gab, why did you say that?
We're not cool. We're able to compensate for the increase in number of COVID now.
So why did you say that? I think I heard you say that it's not as if we learned from our experience the last time. How do you mean?
If we did not act accordingly, I mean, reading the increase in the numbers, and if we did not adjust our daily activities, it's not as if we didn't learn anything. It's as if we didn't learn anything from the past, meaning we know exactly how this virus will roll out if it starts to increase in numbers, as it did in July and August. And we know better how to respond to it. So that's why there is some movement in the number of cases we're taking in and in the number of beds that we're allotting to it. But it's not as if we're being overwhelmed. No, we're just moving so that just in case it gets to a higher level than what it is now, we are ready for it.
It's good that you said that it's not as if you're overwhelmed right now, but tell us a situation. How many beds do you have at the moment? And how many patients are there?
So our current census is around 98 as of today, with a peak of 110 a few days ago. We have 140 beds for our COVID operations. What we noticed though, Pinky, is that more private patients are coming in than the public patients. So we have a few beds for private also. They're getting filled up more than the public beds. So that might be an indicator that maybe private patients have a tendency to seek consult earlier than the public patients. So this is why the private beds are getting filled up earlier.
But why would that be? Because if you're saying that the private beds, they're seeking consult, but that also means that they're taking up the beds, right?
Yes. So there are separate beds for private and public here in PGH. Of course, we have more public beds for private. There are around 100 plus. When we prepared for the 230 beds, there were 180 beds for public patients. So we just observed this trend because this is how it happened in July. If you notice, the private hospitals, the big private hospitals were the first ones that were overwhelmed in March and in July. So it's the same pattern we're seeing now. That's why we're adjusting calibrating our response also to that.
Dr. Gap, I hope you don't mind. I need to clarify what you just said. So you have private beds and public beds, but in total, does that total 140 beds? Because that's a number you gave me a while ago for both public and...
Yes. So both for public and private.
I see. So 140. And then in the event that dumami pa po ito, you can open more beds. More beds can be available.
Yes, as I said, we were up to 213 at the peak of COVID.
Yeah.
But you should remember, Pinky, in the lull of the infection, we were overwhelmed with non-COVID patients because people started to move again and seek health care. The ones that were neglected in the long months of being closed as a COVID referral center. So that was the big challenge we had, how to balance this public service. Non-COVID patients outnumber the COVID patients. If you go by statistics here in PGH, in a given day, we have 100 patients in the ER. Only 3 or 4 were COVID in the past few months. No? So we cannot not open our beds to the non-COVID patients because they have nowhere else to go.
Yeah.
So we have a policy of not to refuse patients who come to our ER, except now, except like now when we have to, as I said, adjust and announce that we will only take in life and limb-threatening conditions as well as imminent deliveries and trauma. So that's what I meant by adjusting accordingly to the
I see.
situation.
Yeah. In other words, Dr. Gap, what you're saying is kung hindi naman talaga napaka-importante o kinakailangan, wag na muna kayo pumunta sa PGH because you will not be attended to, correct? It will be through online consultation.
Okay. Yes. In the ER, you'll be attended to, but you'll probably be referred to another hospital. And I'm thankful to the One Hospital Command Center for that under Yusek Bong Vega because it was very active in the transfer of patients from our hospital to other hospitals. In the outpatient, we are still seeing patients, but we are discouraging walk-in, because walk-in patients could not be screened accordingly. So we have this online consultation pre-screening, and then we give instructions to the patients on when and how to get to PGH with their concerns. So we haven't closed the hospital. We're just
Managing.
Adjusting.
Yeah. Okay.
The non-urgent ones, we are advising them to go to other hospitals
But
first.
on a daily basis, looking into COVID patients, how many are you admitting on a daily basis, on an average, the past week or 2 weeks?
So we've had an average of around 12 to 15 admissions a day in the past 2 weeks. So what we do is, of course, we try to discharge as much patients as we can, or transfer them to the quarantine centers that allow us, that take in our recovering patients. So that's how even if we have a lot of patients that we need to admit, we're able to discharge and transfer patients, allowing us to have the efficient cycle of patients coming in and being discharged.
If I'm not mistaken, you said you have about 98 patients right now?
Yes.
Would you describe them, their stage of the COVID-19 infection as what?
Okay. Most of them are moderate. I would say 70% are moderate, 30% are severe and critical. So that's about the same. The ratio of severe and critical for some reason is less now than we had in the past, because we used to get really the sick ones, and some of them would not make it, just landing in the ER, and then they would not make it because they were too sick. But now our ICUs can take in a few more patients, unlike before, they're always full to the brim at any given time. So I think although there are more patients, even if there are more patients coming in compared to the last few weeks, the number of really sick patients are relatively less than before.
But just want to look into the numbers again very quickly, Dr. Gap. If you have 98 patients right now and you have about 140 beds, and if you average about 12 to 15, that gives you a deficit of about, 40? Without having to add more rooms. So
yes.
If you were to get another 15 cases a day, that 40 beds that you allot, that'll be done in three days. Hindi ho ba?
Yeah, so yes, but the key there is the discharges also. So remember, patients are recovering as well, so we can discharge almost in the, not really the same number, but at a number that we can, that allows us to continue admitting patients in. So
because 70% you said is moderate and about 30% are the severe and critical. Obviously, the severe and critical will not be able to be moved, but hopefully you're saying the moderate gets better and they can be moved to quarantine facilities?
Yes.
Okay.
But you must remember also probably the lesson that people learn with COVID is the earlier they get medical attention, the higher the probability
Correct.
of surviving the disease. So I can imagine how frantic patients are when they learn they're positive with mild symptoms and more comorbidity. They run right into the
Yeah.
hospital for care. So that could be one reason also why after 1 year we see patients lining up to go to the hospital, because the year that has passed has taught us that the earlier you seek consult and the earlier you're monitored and given advice, the higher the chances of you making it.
Philippine General Hospital Director Dr. Gap Legaspi, sir, thank you so much for your time.
Thank you. Thank you too. Good
We'll be
morning.
taking a short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Let's now talk to St. Luke's Chief Medical Officer and Vice President Benjamin Campomanes. Dr. Campomanes, thank you so much for your time. I'm going to start with this. We were texting each other yesterday. You said that in BGC, there's about 102 bed allocation for COVID-19 patients. That's 70 to 80% occupied. In QC, 109 bed allocation. That's 60 to 70% occupied. How would you describe the situation in both St. Luke's, BGC, and Quezon City right now with regards to COVID-19 patients and admissions?
Yes, so thank you, Pinky, for having me. We have actually anticipated our numbers to increase, and as you well know, everybody's anticipating an increase. So as of 6 a.m. this morning, that 102 and that 109 is actually based on our 20% rule that is what we agreed upon with DOH. That is 20% of our beds on both hospitals. So as of now in BGC, 20% of our COVID allocation beds are already 90% full.
Oh.
And in Quezon City, out of 109, again, this is a 20% allocation, is 70% full. What is a little bit alarming is that in Quezon City, our ICU now that we have allotted are 100% full. So we need to transfer our ICU COVIDs to our facility in BGC, which is the ICU there is only 50% full, because we have allotted more ICU beds, which is actually 18 ICU beds.
So you need to move those already in
If
QC, the ICU
yes,
patients.
if we see a patient for ICU admission in Quezon City, then we will have to move them either to our global facility or transfer them to another hospital.
Dr. Campomanes, what are you seeing with regards to the profile of these patients? Because there's talk that there's an increase because there's family clustering. Others are saying it's not really family. Is there anything similar or common among the patients being admitted now?
It's a mix. So I can't tell whether they're really individuals or because we see a family cluster too, father, mother, or father and children. So we do see that also in our population of patients.
Okay, and I asked Dr. Gap Legaspi this. With regards to the stage of their infection, are your patients more moderate or more on the severe critical stage?
Yeah, Pinky, we do not accept mild cases to the hospital. We only accept moderate to severe.
I see. Okay.
If you are diagnosed as mild, then you're either referred to a quarantine area or at home if it would be allowed. We only get moderate to severe cases.
I understand. But in terms of percentage, how much is severe and how much is moderate?
As of now, we see more of the moderate, I guess. That's why we have more in our wards. But we are now very cautious with patients in the ward, because then we've noticed that this is by experience that a lot of patients that we are giving high flow nasal oxygen treatment will crash. So that if if our patients in the ward are already requiring a certain amount of high flow oxygen, then we move them right away to our ICUs.
I see. How would you describe the situation there? Tell us, is it still manageable?
Well, it's still very manageable for us. Again, this is a running thing. I mean, I may be talking about manageable now, and
Right.
we've always managed even before. So we have gotten a lot of experience with regards to this one. So we are ready for whatever that may be thrown at us at this point in time.
But you know, you're right. You know, today I can ask you, and you can say it's manageable right now. But I don't know what. I'm not sure that could be the same answer 3 days from now. Things can just really
Correct.
change. So let's
Correct.
talk about this, Dr. Campomanes. Octa is looking at a possible 5,000 to 6,000 cases by the end of March. What happens if this actually happens? Kasi you know, you look at the numbers right now, that's 3,000, over 3,000 cases the past 4 days. And then so Octa is saying, if we don't take care, this could reach 5,000 to 6,000 by end of March.
Yeah. So what we're doing now is actually we even looked ahead, and because the agreement with DOH is we start off with 20 and then we are ready for 30. So 30%. If we add another, for example, from our 102 bed, we can increase our bed capacity in global, for example, to 150.
Yeah.
So we have already made contingencies.
Yeah.
If that happens, we're ready for a 30% allocation in
Right.
our hospitals.
From 20%, you mean, from 20%
Yes.
to 30%. So also just very quickly, I wanted to find out any issue on the South Africa variant, because the variants are also being said to be the possible cause in the rise of the COVID patients.
Yeah, well, we rely on the government. We don't have the facility of telling which one is a variant. So I have no data on
Yeah.
how many variants there are really.
Pero wala pa pong
So-
nahahawa, wala pang positive na healthcare worker that was positive and then known eventually through the Genome Center that that's the South Africa variant.
No, as of now, we don't have any data on that one.
Okay, last, sir, the vaccine rollout, I remember Secretary Galvez was saying humingi nga ang St. Luke's ng, I believe, 5,000 or 6,000 back then. I'm not sure of the number. How is the vaccine rollout? Ubus na ho ba yung inalot sa inyo?
Hindi pa. Well, the problem is on vaccinating people, because as of now we need to vaccinate about 400 of our employees every day to finish up by the week. So that's an issue. So I think all of 90% of our employees will be vaccinated. Now it's just the number, because as I said, we need about 400 to do 400 per day. That's why we need to extend our vaccination hours, and we have been instructed by DOH, if you need to do it 24 hours, we will do it.
Sorry, Doctor, overtime na po ako, but I'm just curious. Is it hard? Is 400 vaccinations hard in a day? Is that a big challenge?
In the beginning, we were looking at our time, you know, how long for one person to get vaccinated. But we are seeing that we need to monitor these patients or these vaccinees for a longer period of time, because there has been some increase in blood pressure, some rashes. So we need to keep them there for a longer period of time. And that, you know, blocks our
Okay.
flow. So that's the reason why sometimes we can't reach the 400 a day.
St. Luke's Medical Center Chief Medical Officer and Vice President Benjamin Campomanes. Doctor, thank you and take care.
Thank you.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.